Good morning. I wanted to talk to you a little bit about knee injuries and in particular, a very common knee injury that most people are probably going to unfortunately experience at some point in their life, and that's a meniscal tear. So the knee is a simple but very complicated at the same time structure. We have ligaments that run north to south on each side of the knee, inside and outside. We have two main ligaments that crisscross in the middle, the ACL and the PCL. And then we have two bones that kind of come together like this. And in between those two bones, we have thick cartilage that is essentially the shock absorbers for the knee. This is the meniscus. So if you were to say, what is the meniscus? It's two thick pieces that are semicircular shaped. They range from the front of the knee to the back of the knee, and they kind of kiss, but they're not one piece, they're two. If we were to take off the top part of the knee and look straight down, you'd see that the outside edge is really thick, and as you get towards the middle, it gets really thin. The in front part is where it kind of sits in, and the back part in the back of the knee is actually where it inserts into the knee, into the bone itself. And then there's what we call meniscal femoral ligaments, with these little small ligaments that kind of stabilize the meniscus that are found on the sides. So the purpose of the meniscus is kind of like the shocks for your car. Every time you hit a speed bump or a bump in the road, the purpose is to take some of that cushion and prevent a big hit. Well, we have one in each knee, or meniscus on each part of our knee. And if unfortunately you injure it, you're going to have issues as a result. So the meniscus is something that's going to continually do its job, whether or not it's injured. Unfortunately, it does not have a good blood supply. So if you look at it, again, if we were to chop it in half and look straight down, the outside edge is what we call the red zone. That actually heals quite well because it has a good blood supply and it can bring in nutrients. Well, as you get closer to the inside, that does not heal well because that is what we call a white zone, or an avascular area that does not have good blood supply. So if you were to injure yourself on the outside edge, there's a good chance your body will heal it. Well, if you happen to injure it on the inside, or a crisscross between the two zones, there's a good chance it's probably not going to heal. That's when usually people come in and say, I have this awful knee pain and I'm sick of it. So what types of pain would you describe? So the classic questions I will ask is getting up from a seated position, twisting, like if you were to get in and out of a car, that type of movement. If you were to squat down to grab something low from a shelf, any of these can cause discomfort or pain. And this pain is usually traditionally described as either a sharp stabbing, almost like a knife, or this throbbing, aching, they just kind of know it's there. If it's a new injury, usually there will be a lot of swelling. If it's an older injury, it may not have as much swelling, but it's just, you kind of know it's there. Depending on the location of that tear, you can have it on the front, you can have it in the back, you can have it on the outside of the knee or the inside of the knee, and you can also have several of it, is a possibility as well. Each of these, unfortunately, have different treatment plans. There are several different ways to treat this. Unfortunately, none of them are ever going to be perfect where you can get a new meniscus. So in the young people that have unfortunate ACL tears, a lot of football players will have this. If you remove the meniscus or a piece of the meniscus as a result of the injury, and while you're trying to fix the ACL, what you'll notice is that because you don't have a big piece of that meniscus, that person is going to have substantial arthritis probably within the next 10 to 15 years, depending on how big of the tear is and how active they are. If you either repair the meniscus or you leave it in there and kind of get it to calm down, you're going to prevent some of those future injuries, because it's like you essentially removing the shocks for one or two of your tires of your car, hitting speed bumps and still not expecting any injuries at those tires or in those wheel wells. Of course you're going to have some because there's no cushion. That's the importance of the meniscus. Without the meniscus, all of us would have really bad arthritis in our knees pretty young in life. So the meniscus cannot be understated. When someone replaces a knee, they actually remove the meniscus and kind of put in it's basically like a plastic buffer that essentially prevents smashing of those two metal joints in between, so it provides a cushion. Ideally, we would have a perfect meniscus so we don't have to worry about it, but injuries happen. Think of it almost as if like a piece of paper. The piece of paper would be a perfect meniscus. But what can happen is you can rip that piece of paper. So now say half that piece of paper is flipped up on its edge. That's going to create immediate swelling and a lot of pain. Whenever you twist your knee, you're going to have pain because that twisting motion is very important for what the meniscus does. Now think if that meniscus, that tear is flipped over on itself, almost like a piece of paper that's folded on itself. Now there's going to be a piece of bone exposed to the bone above it because that meniscus is not there to protect it. And every time you feel that, you're going to have usually a sharp stabbing pain in that part of your knee with certain motions. If the tear is big enough, you may not even be able to walk. It will literally immobilize you, and that's usually when you know something's wrong. So let's talk a little bit about treatment. How can we treat this? So the first step is diagnosing the issue. The second step is determining how bad the tear is. Is it a little minor thing like I have in my knee, or is it a huge, what we call bucket handle tear that needs to be addressed without question? And in doing that, you can do a couple different ways. Exam works really well. Ultrasound's okay for meniscus. MRI is the gold standard. Just depending on how aggressive you want to be and how much it bothers you and what your goals are. As far as going forward from that, if it's a minor tear, you can get away with just physical therapy. That will help calm it down. If it's a big tear, sometimes physical therapy is not enough. If you wanted to have, consider the surgical route, you really have two options. What they call a meniscectomy, which is removing a small piece of that meniscus and trimming it out and kind of calming down the layer in there. That's the most common thing. You can do a meniscal repair if the location is correct and if it's a huge piece, but the issue is these usually take several months of really not walking on it to really heal, which is usually not realistic for most people. Usually that's only done when an ACL tear is combined with it. So let's talk about other different types of treatment options. So while therapy helps, sometimes it's not enough, especially if the tear is big. Sometimes people don't want to undergo surgery because they want to keep as much meniscus as they can. But the harsh reality of it is, hey, there's Dr. Goddard. Come on in.
How you doing?
Good, how are you?
Good.
My partner in crime. So, and the other option is injections. So you have a couple different types of injections. If you just want to numb up the joint and decrease the inflammation but not really change anything, you can do a steroid injection. If you want to actually put good product in there and decrease the inflammation, now we're starting to talk about regenerative medicine. So in that regard, we're in regenerative medicine, we're starting to talk about PRP, we're starting to talk about like stem cells that you can get from bone marrow or adipose tissue, or you can even talk about some higher level stuff like umbilical or Wharton's jelly, that type of stuff. So there's several different options, and it just depends on how aggressive you want to be and how bad the injury is. So I hope this was helpful today. If you have any questions, comments, concerns, we'd love to hear them in the comments below. Thanks. Take care.